Today we're going to be talking about osteoporosis. But first I've got to read a brief disclaimer. Dr. Naomi Albertson is a physician at the Reno Orthopedic Clinic and the owner and developer of Diagnose OC2, a bone health and muscle strength supplement for adults aged 35 and older who want to stay active. The information in this podcast is intended for your general information only and is not a substitute for medical advice, diagnosis, or treatment for specific medical conditions. You should not use this information to diagnose or treat a health problem or disease. Always seek advice from a healthcare provider with any questions or concerns you have regarding your health, and never disregard professional advice or delay seeking medical treatment because of something you hear on this podcast. Dr. Naomi Albertson and Dr. Knives make no representation and assume no responsibility for the information in this podcast, and such information is subject to change without notice. Hello and welcome to the Why Act Your Age podcast with Dr. Naomi Albertson. My name is Rob and I'm here with Dr. Albertson. Hi, Nye.
Hi.
Hi, you ready to talk about osteoporosis today?
Absolutely.
Sounds great. So I was actually looking at some statistics on osteoporosis and it's rather sobering. And I thought we'd start there before we jump into having you describe what osteoporosis is and sort of signs you might look out for on your own, because my understanding from speaking with you in the past is that sometimes doctors miss warning signs that people have osteoporosis. Is that right?
That is right. It's really a challenging diagnosis to make sometimes.
Gotcha. So it's helpful if people kind of know what to look for on their own so they can discuss it with their doctor. So first, let me give you some of these statistics. Really sobering, like I say. Worldwide, there's a osteoporosis related fracture once every 3 seconds, which is pretty amazing. And these are all worldwide statistics. 1 in 3 women over age 50 will suffer a fracture at one point in her life, an osteoporosis fracture. And people think of osteoporosis as a disease that affects women, and it does disproportionately affect women, but here are the statistics for men. 1 in 5 men over age 50 will suffer an osteoporosis fracture. And if you're a man and you're over age 50, your risk of suffering a fracture from osteoporosis is twice as high as your risk of developing prostate cancer, which is, it really struck me as a statistic that really pops out and shows you just how prevalent this is, even among men. So go ahead, Dr. Albertson, and tell us a little bit about what exactly osteoporosis is.
Sure. So first of all, thanks for that introduction. I mean, it is very sobering how many fractures or broken bones are resultant from poor bone quality, which is really what we're going to be talking about here with osteoporosis. So I usually explain to my patients, Rob, that osteoporosis is just like the name sounds. So osteo is bone and porosis is porous, so porous like a sponge. And bone is normally porous, but what happens with osteoporosis is that there's sort of more holes in the bone than cross-bridging of normal bone. And so the bone substrate, if you will, or the ability of the bone to withstand fractures or breaking is problematic. And so you wind up with brittle bones or bones that are at higher risk for breaking.
What are some of the causes? Do we have a good understanding of what leads to osteoporosis?
Absolutely. I mean, there are a number of risk factors, and I would encourage all the listeners to check out some of the websites out there that really spell a lot of this information out. But, you know, the National Osteoporosis Foundation being one of them is really an excellent source for patients. And really anybody who's interested in learning more about osteoporosis. But to try to hit a couple of those risk factors, certainly women experience more osteoporosis than their male counterparts, like you mentioned earlier. After menopause, for women, that is the fastest rate of loss of bone. And so it's important, being menopausal is certainly a risk factor in and of itself. Now, that could mean just that, maybe you had, as a woman, an early hysterectomy in life, so your uterus and ovaries taken out, and that would cause you to be low estrogen. So really a better way to think about it is in estrogen poor state, if you will. Other risk factors, being Caucasian and being Asian are both risk factors. Being very slim or small, believe it or not, is a risk factor. You're just not as big a person and you have higher risk. Being a smoker, being on several different types of medications, things like steroids on a chronic or regular basis, some cancer medications, so certainly important to talk to your oncologist if you've been treated for cancer to make sure that those medicines are not problematic for your bone quality. And then alcohol, believe it or not, the National Osteoporosis Foundation says that drinking 3 drinks a day on a regular basis, 5 to 7 days per week, is its own independent risk factor for bone quality.
Wow. So lots of factors.
Absolutely.
So I've heard the term osteopenia thrown about as well. What exactly is osteopenia?
Such a great question. So osteopenia is essentially the diagnosis of bones before they have reached severe or more severe osteoporosis. So it's sort of a spectrum, if you will, from normal bone to osteopenia to osteoporosis. And those two diagnoses, believe it or not, osteopenia and osteoporosis can be made clinically by risk factors, but also can be made by bone density study or a DEXA scan.
But that's at the point where a medical professional has identified you as at risk. So let's talk about, since you say it's a difficult diagnosis, let's talk about some of the warning signs that someone might look out for early.
Absolutely. So I think, first of all, the thing that gets missed quite often is actually pretty surprising, but anybody who has had a fall, so from a standing height or below, so sitting height to the ground or standing height to the ground. So that means not off a ladder, not on an ice bank, not off the top of your car, right? But just standing height or below, and has fallen and broken a bone other than a finger, a toe, or a rib, those all constitute what's called a fragility fracture. And what that really means is that, your bones should be able to withstand that force of you falling from standing height. And so if you break a bone from standing height or below, that is a really significant risk factor, and it is you can actually make the diagnosis of osteoporosis from just having had that fracture. So I think it's really an important one. It gets missed all the time. And I think, it's critical that we actually, as physicians and as healthcare providers, just start saying, wow, that fracture shouldn't have happened. And now I need to look a little further into how to help you to, improve your bone density. Did that answer your question?
Yeah, and that would be at any age then, right? Not necessarily somebody over 50. You're talking it could be even in your 20s or 30s. Is that right?
Absolutely. It's any age.
Okay, so let's say I fell and I can't count myself personally because I have broken a finger before, but I've never broken a bone falling. But let's say I fell and I broke a bone and I was about 30 something, and no doctor picked up on this as a possibility. What might be the next thing that might happen as I got older?
Yeah, it's such a great question. So, bone density, again, we're going to reach our maximal bone density somewhere around age 30, 35. And then after that point, we start to lose bone over our lifetime. And so that's why, although yes, fractures happen in younger patients, it's not usually osteoporotic related at those younger ages. Where we really worry about these fractures is in your 40s, 50s, 60s, and beyond. And I think for anybody in that category of 40 or older who has, say, fallen and, say, broken their wrist or their radius bone in the forearm, they absolutely have a diagnosis of osteoporosis until proven otherwise, right? So really paying attention to making the diagnosis, because it's a treatable condition, is really critical. And I think, Rob, it deserves mentioning that, part of the reason I think that osteoporosis really doesn't get the press that it deserves is because people don't really think about breaking a bone as being like, oh, this is this horrible, terrible thing, right until they have one, right? So for anybody out there who has broken their dominant wrist and had to be in a cast with their elbow bent at 90 degrees for 6 to 8 weeks, I mean, this is massively impactful on your life, right? You can't get yourself dressed. You can't, get into and out of the shower very comfortably. You can't, you really, driving becomes problematic. I mean, all of these things, right? And then if you look at other types of fractures that are more severe, things like hip fractures, I mean, I don't know if your population who's listening to this podcast understands, but, hip fractures are associated with dying 25 to 30% of the time after they occur, just because of complications, right? Whether it's requirements for surgery or pneumonias that follow because you can't be as active. The other statistic that always kind of floors me is that so many patients, I mean, 30 to 40% of patients who have a hip fracture never go home again. They're stuck in nursing home settings or not able to care for themselves. And I think, that's not anybody's goal to wind up in a nursing home. I think all of us want to stay independent and, be able to care for ourselves as long as possible. So, I mean, I think part of the reason, again, that osteoporosis doesn't probably get the press that it deserves is because we don't really think of like, oh, a bone is going to kill me, right? It's not like a heart attack, but it does have associated death rates, right? Because of all the complications associated.
Sure. Do you think most physicians, like say your typical, GP, your family practice doctor, do you think most physicians, when they see somebody with a broken bone, instantly think I should screen this person for osteoporosis, or do you think it gets missed a lot?
I think that really osteoporosis gets missed more often than it gets picked up. And I can speak to that as a primary care physician as well as a family practitioner. The times that I have practiced family medicine, unfortunately, the primaries are in a really tough spot because they see these patients typically for hospital follow-up or urgent care follow-up or orthopedic follow-up, right? And if there was a fall, your primary care doctor in your 60s, 70s, and 80s is worried about why did you fall? They're not necessarily worried about, oh, what's your bone quality, right? So they're going to go down a road of like, gosh, looking at, heart irregularities and heartbeat, abnormalities and carotid artery, occlusions and things like that might have resulted in a fall. And so that unfortunately takes up the office visit, right? So unfortunately, as a primary care provider, I think it's so hard to make the diagnosis and then to have the time in a traditional office setting to actually discuss with your patient, what options there are for not only preventing further fractures, but also for treating osteopenia or osteoporosis.
So really, it's largely up to you. If you've broken a bone and you think this might be an issue, you should discuss it with your doctor.
Absolutely. I mean, I think patients are your own best advocate, and I think having knowledge about, fragility fractures and or the risk factors that are associated with osteopenia and osteoporosis and bringing it up to your provider is absolutely the best way to go.
Is osteopenia and osteoporosis, are they the kind of thing that if you intervene early, there are effective treatments for them?
Absolutely. So, there are not only non-medication treatments, so things like exercise and taking the right supplements, right? Getting the right supplements in your diet, strength training, like we've talked about a lot of times before, is lean body mass, so muscle mass is the thing that drives normal bone turnover. So, getting going on a regular exercise program can be critical for bone density. The other things, of course, there's medicines out there. There are, a whole slew of medicines that absolutely having those conversations with your doctor or your healthcare practitioner, is critical because those treatments all have improvements in either, decreasing fracture risk and or improving bone quality or bone density.
Okay, and I know in older people, particularly, not only does you're talking about muscle strength, how it helps normal bone development, but the studies show pretty clearly that after age 65, the stronger you keep your muscles, the less likely you are to fall and injure yourself or potentially break something in the first place. So there's a
Absolutely.
couple of benefits there to staying strong as you get older. We should step back for a second and mention, because you're talking about, among other things, supplements, and I want to ask you about that. But first, full disclosure, you and I both own a supplement company that sells a frame support supplement that you formulated that part of its focus is on bone health. The other part of its focus is on muscle strength. So it's kind of interesting and pertinent to this discussion. But and if people want to read about that, they can check it out at boneandmuscle.com. But in general, what kind of supplementation would somebody want to look at?
Yeah, so I think, the research that is available about just normal bone turnover and, what is available about giving your bones what they require for developing nice, strong, healthy bones is available on, again, I would recommend the National Osteoporosis Foundation's website. In general, Rob, I usually tell people that, getting these things in your diet is absolutely the best way to get, your vitamins and your minerals that you need. And so really paying attention to certainly calcium and vitamin D, which have been shown over and over and over to be critical for normal bone. But now there's some information about magnesium. There's still some question about vitamin K. I get a lot of patients that ask me about that. And I think, the three critical ones are for sure vitamin D, calcium, and magnesium. And again, I would encourage your listeners to check out the National Osteoporosis Foundation website, because not only do they have, the specifics about how much of each of those for both men and women, but also there are a number of calculators that you can use on their website that help you to look at, what you're actually eating in your diet to see if you even need a supplement. I mean, you might be getting enough calcium through milk or, cheese or fortified foods like orange juice and things like that. And maybe you don't even need any, So if you're getting enough in your diet, that's great. But if you're not, then absolutely supplementing the calcium, vitamin D, and magnesium is important for normal bone development.
Gotcha. Most Americans don't get enough calcium in their diets, though, isn't that right?
Yeah, both calcium and vitamin D. The other thing that's kind of interesting about Americans in general is that we have such a huge part of our population that are using medications for upset stomach or for acid reflux. And those medicines actually interfere with the absorption of vitamin D and calcium. And so it's really an interesting problem because, here we are treating one problem and then inhibiting normal absorption of the other things that you need for a normal bone.
So people might be getting enough calcium, they're just not absorbing it because they're on some sort of an antacid or something like that, correct?
Exactly. Yep,
Okay.
exactly.
Okay, so aside from supplements and then potential treatment with drugs, what else can you do to think about your bone health in general?
So other than, supplements and medications, really, we're talking about exercise. There's been a lot of research over, 50 years or so about exercise. And does exercise or weight-bearing exercise actually increase your bone density? And unfortunately, I would like nothing more than to tell this audience that yes, absolutely, weight-bearing exercise is the answer, and you'll never need medications if you do that. Unfortunately, I think the research is fairly clear that, weight-bearing exercise can be a stimulant to bone, but when there have been studies looking at bone at baseline and then following patients through exercise programs, even for, 14 to 16 months later, we can't really measure those differences in bone density. And so it is kind of interesting because we do know that those exercise programs absolutely help with muscle strength. And again, muscle seems to be driving bone turnover, but also, like you mentioned, Rob, muscle is critical to help you prevent the fall in the first place. And so, when we look at exercise, it's such a complicated issue because it's probably not giving a direct improvement in bone, but it is indirectly improving muscle and therefore decreasing the risk of an osteoporotic related fracture or broken bone. So I hope that made sense to your listeners. Exercise, I have like many other primary care providers out there, told patients for many years that, weight-bearing exercise is more important than non-weight-bearing exercise as it relates to bone. And it turns out that probably that's true, but again, more because of the muscle recruitment than because of what the exercise is doing directly to the bones.
Anything else about osteoporosis that you'd like people to know about in general?
I think, again, just to kind of reiterate, that osteoporosis is something that is very common in the general population. It doesn't mean that you did something wrong or that you've, created this condition. It has everything to do with how dense your bone is when you're young. And, there are many people out there who, didn't have access to good food and or maybe had medical issues even as kids that prevented normal bone development early in life. And so, I always tell people, it's like, you don't have to feel guilty about this diagnosis. It's not, you didn't do anything wrong. And it is a treatable condition, and it absolutely can improve, your quality of life to treat this condition.
So just to recap, the important things when thinking about osteoporosis are you need to be your own best advocate more often than not if you've broken a bone, really at just about any age in adulthood. It's something that happens to a lot of Americans, a lot of people in general, from the statistics I read at the beginning. You want to think about diet to make sure you're getting the proper minerals. If you're not getting enough through diet, you want to think about supplementation, and keeping your muscles strong seems to play a really important role in keeping bones strong and healthy. So does that sound about right?
Yeah, that sounds great.
Excellent. Well, thank you very much for telling us all that. Next time, we're going to talk about lower back pain, and something we've all experienced at one point, unfortunately. Dr. Albertson is going to explain the most common reasons for back pain, what can be done for it, and some tips that might help you prevent it in the first place. In the meantime, don't forget you can subscribe to our podcast, and we look forward to talking to you again soon.